Greetings, everyone, to our audience tuning in via Zoom. I am thrilled to welcome you all to Keeping Your Loved Ones Safe. I am Eric Feil of Richner Communications, and as with all the Herald Inside LI webinar presentations, we're thrilled to have you, thrilled to have an incredible panel of guests here today. So the topic, keeping your loved ones safe. Throughout COVID, throughout the pandemic, our goal as a society has been keeping our loved ones safe, our healthcare workers safe, the system safe, so we can get the care that they need and have the confidence to know the best protocols that are in place to make sure that everybody can stay healthy and wealthy and wise. Why not? Because information is health and wealth, right? So what we're going to do today is thank our sponsors first. We could not bring this great group of panelists together without our sponsors today. Glen Cove Center for Nursing and Rehabilitation, Emerge Nursing and Rehabilitation at Glen Cove, Harbor House Caring for the Memory Impaired, Oyster Bay Manor Assisted Living, and Glen Cove Hospital Northwell Health. Again, thank you to all of those sponsors for helping bring this webinar together here, because the timing could not be really more perfect. As we're heading into fall, we start to hear again the questions that we heard last fall about safety, about wellness, about vaccines, about seeing one another as holidays start to come around, more indoor activities. But we've also come a long way in this past year. So our distinguished group of panelists today, I will introduce them and then give each of them the floor to tell you more about themselves. We have Dr. John Colletta, Dr. Usman Khan, Madeline Moritz, Melissa Schuhmacher, and Erika Weber. Welcome to all of you. Dr. Colletta, would you like to kick things off introducing yourself?
Sure. Good afternoon. Thanks for having me today. I am the chairman of the emergency department at Glen Cove Hospital. I've been here 35 years in our ER here. I'm board certified in emergency medicine as well as internal medicine, and enjoy participating in these sort of informational things.
Excellent. Well, thank you for joining us. Dr. Khan.
Hey, good afternoon, everyone. Good to join you guys. My name is Dr. Usman Khan. I've been with Northwell Health for 3 years. I'm the director of geriatric medicine over at Glen Cove Hospital. I'm also the hospitalist, so I do take care of the patients that do get admitted from the emergency room and stay overnight or longer in the hospital. I've specialized in geriatrics as well as family medicine, and I'm glad to join everybody here for this.
Well, it's great to have you. Thank you so much. Madeline.
Hello, good afternoon. I'm happy to be here. Thank you for inviting me. I am the administrator for the Glen Cove Center for Nursing and Rehab. I've been here since 2014. My background is in social work. I'm a licensed master of social work, and I've been in the healthcare field for over 20 years and actually started right here in this very facility.
Excellent. Thank you again for joining us.
Thank you.
Melissa.
Thank you. Good afternoon, everybody. I'm excited to be here. My name is Melissa Schumacher, and I am the Director of Business Development for Harbor House Memory Care and Oyster Bay Manor Assisted Living, both communities right here in the heart of Oyster Bay. I've been in the industry for over 20 years, and I come from a background of my undergrad and my master's in the study of gerontology. So my passion has always been caring for the elderly, and certainly that's what we do here at Harbor House and Oyster Bay Manor. Thank you.
Erika.
Hi, good afternoon. Thank you for having me. I'm Erika Weber. I'm the administrator of Emerge Nursing and Rehabilitation at Glen Cove. I have been here since February of 2019, so I'm very excited to be here in the Glen Cove area. I have a master's degree in healthcare administration, and I have had experience in long-term care, assisted living, home care, hospice. So I've had the gambit of experience. So I'm very excited to be able to speak with everyone today. Thank you so much.
Excellent. Again, thank you so much. And thank you to everybody for joining us. So throughout the sign-up process, we have had a lot of our viewers send in questions. The topic is broad. How do we keep our loved ones safe? And again, particularly the elderly, our senior, our parents, grandparents, who were the most vulnerable, not just during COVID, but I would think, and I'm no doctor, I don't even play one on TV, but I would think even prior to the pandemic starting. So I'd like to start with Dr. Colletta. And one of the questions we had was, emergency departments across the country had to reorganize, they had to adapt, they had to make changes for not just an influx of patients coming in to seeing, did I have COVID, but also for safety protocols and to keep everybody safe. Where are they now? And what are some of the protocols that were put in place that are still going to be carried forward?
Right. So what we've done is to ensure that everyone is wearing proper PPE, masking, patients masked. The luxury I have here, if anybody's been to Glen Cove ED, is that I have private rooms, which makes it very easy to manage infectious problems, COVID, everybody has their isolated room. And now it's just so hardwired for our staff to be properly masked and wearing all the proper PPE that, I would say by now we're absolute experts, and, we understand that it causes a lot of anxiety for people to come to the ED and say, I don't want to go to the ED. That's where everybody's congregated that probably has COVID. Well, that may be true during the pandemic when we had it, but we did a very good job of isolating people, and we had enough PPE. There was never a shortage, so it was really fine.
Excellent. And again, I think you're exactly right. The fear and the image of going to the emergency department with a large crowd of people, someone sneezing or coughing in the corner, someone there, nobody really knew what they had and how they could be safe. So again, I think getting the information out there that emergency departments are safe, you can come in if you need to visit, need to care, is an important one that we all need to kind of push forward. I mean, is that something you think that is on the forefront now of getting messaging out there like that, or is the public really starting to get that already?
I think what we have seen is that people are holding off on their medical care, right? Whether even going to their private doctors, they're just not going. So what ends up happening, they're sitting home getting sicker and sicker, and some of the routine care, which would have probably negated an emergency room visit, now they're coming to the ED. And so what we are finding is that the people who are coming are much more acute and because they waited for a longer period of time. And so we're trying to get the messaging out there that if you should see your doctor, if you have to come to the ED, you're going to be safe. Don't wait till it's, for example, for stroke, if you have stroke symptoms, please don't wait, come in immediately. We're finding people are sitting at home waiting, and then until they can't make it anymore and they come in, and that's bad, right? So I think that's the worst part of probably the pandemic that we're seeing right now. But the ERs are safe across the North Wales system. We have a very good system. If you're worried about COVID and you might catch it here, we have a good system that you'll be isolated.
Excellent. So, Dr. Khan, would you like to speak to that point, the question of people who have not maybe been getting their regular care, going to see their doctor as regularly as they would like? I had read some study from the University of Michigan, I think it was, that it said, and this was last year, that 1/3 of Americans between 50 and 80 had put off going to a doctor's appointment during COVID because of that fear. What are some of the big issues you've seen there? And then how can we help people kind of get around this corner?
So just to pretty much piggyback on what Dr. Colletta is saying, he's absolutely right. It's not more so the COVID that has been a concern for our older patient population. It's more so because of the fear of COVID and coming to the hospital or even going to their primary care doctors that's actually caused them to have their chronic conditions become exacerbated. Dr. Colletta gave the example of a stroke. To me, stroke is something that, it's sudden onset, you have the symptoms and you need to go to the hospital. But a lot of our elder population have a diagnosis of, for example, heart failure. And before it becomes to an exacerbation point where you need to go to the hospital, people with heart failure do know the signs or the warning signs that are coming about that they need to have a medical care taking place. For example, if they start noticing their legs start swelling up or they start noticing their weight is going up, those are red flags that they need to see their cardiologist or their primary doctor. But it came to the point that they go into full-blown exacerbation where they have a difficulty time breathing or laying flat. And at that point, it's warranted to come to the hospital. But this fear of not coming to the hospital or seeing your primary doctor because of COVID, initially that's something that was during the pandemic, but now there is so many safety protocols in the offices as well as in our hospital that people shouldn't have that fear in them anymore. We have proper gowning, we have proper mask wearing, we are checking temperature at the doors. We are making sure that visitors that do come in, they have a certain time frame that they can visit their loved ones. And even those that are visiting, that they have either a recent PCR testing for COVID that they're negative, or if they can show proof of their vaccination. So certain protocols are in place to make sure that our patients are safe and prevent them from getting exposed to COVID.
And Erika, in the world of nursing and rehabilitation, what have you seen as far as this subject goes, with people perhaps having a fear of getting out there, going through it, doing what they need to do to get the care that they need and to help themselves get better and move on?
Sorry about that. So what I have actually seen is one of the things is that, as Dr. Khan has mentioned, is people are putting off things and procedures that they should have gotten a while ago. Knee replacements, hip replacements, things that are, happening that they should have gotten a year ago. And now, as Dr. Khan has said, is now it's an exacerbation where maybe the procedure may be a little bit more complicated. So when they do come to our facilities, we are also seeing residents who are more medically complex. Whereas something may have been a simple hip fracture, now we are dealing with other things like a CHF exacerbation as well, and other things that we are, assisting and having other physicians coming in here. Here at Emerge, we have a lot of different specialties that are able to come to the facility to handle those types of exacerbations as well. So if we are working with somebody who has a hip fracture, we can have the cardiologist come in, we can have the pulmonologist come in. So that fear of having to go out to a doctor's appointment and have additional exposure, we're trying to eliminate, and having the physicians come into the building to take care of those needs as well while they're here for the rehabilitation aspect of, such as a hip or a knee or a surgery that they need assistance with.
And have you seen a growing level of comfort among the patients as this process has gone on? Do they feel more better about it? And do their caregivers, their loved ones, their families, how do they feel about that?
So yeah, we have seen, an increase in people coming back as far as having those type of procedures and those elective surgeries. Recently, probably within the last month or so, we've seen an influx as well of them going back into the OR and coming back into rehabs. It's been a joint effort between the physician's office, the surgeon's office, and the hospitals and our facility to really, speak to the families and let them know that it is safe. We have protocols in place when somebody comes in, whether they're vaccinated or unvaccinated, as far as a resident status goes. We have protocols for visitors when they're coming in. Fortunately, we have been able to allow much more of the visitors to come in, which allows the visitor and the family to be much more at ease, because then they can actually see the protocols that we're putting in place, and it makes them feel more comfortable when their loved one is here.
Madeline, what's been your experience along that same similar front?
So I do agree. I think a lot of people, a lot of families have put off coming to the skilled nursing facilities after a stay at the hospital for fear that the nursing home has exposure and that their loved one now who was in the hospital may be better off going home as opposed to coming to a rehab facility and getting that extra therapy, that extra PT, OT, speech that they might need, nursing care before they go home. And the importance of that is to get home when you're at your optimal point. You don't want to get home prematurely and then wind up back in the hospital. You want to get home and stay home. And that's what we do at the rehab centers. We get you strong enough, we get you stable enough where you can stay home and not have another exacerbation and wind up back in the hospital. So I have seen that families, residents, they are apprehensive to come to the skilled nursing facility for fear of COVID. But once they come in and they see our protocols, we always explain it to them over the phone when they're interested in our facility, our screening of our visitors that come in, our screening of our patients for COVID. Like Erika said, unvaccinated patients are put with other unvaccinated patients on our new admission unit, where they stay until 14 days and they test negative and then introduced to the general population. I think once they see all these things in action, they feel much more at ease. The cleaning processes that we have that are very rigorous for high touch surfaces. There are just so many things that we do and we've been doing since COVID hit that are just above and beyond to make sure we don't have the spread of the virus in the facility. And the other thing that's very important for the families to know and for the patients to know that might be interested in coming to a skilled nursing facility is if we have a patient that we suspect is a COVID positive patient, we test those patients immediately. We have the capacity to do that, fortunately, in our facility. And if that patient is suspect for COVID, we isolate that patient. That patient is not just wandering about spreading the potential virus to other patients. And once that patient, if they do test positive, they're put in a completely separate section with other COVID patients. So it's something that we take very seriously and we work at every single day, and every single staff member really attributes to that safety protocol for whatever aspect of their discipline is.
Melissa, I think the question and some of the fears that people might have of going to a skilled nursing facility would also apply to moving into a community at this point. And how have you dealt with that, and what fears have you seen, and what positive steps are you seeing being taken place now?
Yeah, surely. So it's very similar to what Erika and Madeline were saying in the assisted living world as well. When we were in the height of COVID, it was a big fear to move into communities. It was definitely halted as much as possible. Unless there was a true crisis, families were holding off because of the fear of contracting COVID, obviously in congregate living, but also the inability to visit their loved ones, the inability to see their loved ones. That was really affecting, obviously, the families and the residents. So we saw a lot of that at the beginning of the pandemic. But we have come a long way, like most other places, and we've come to the point now where families are feeling much more comfortable to move into the communities. They are more comfortable because we're COVID-free. We've been COVID-free for quite some time, since last year at some point, and if God forbid we did have something come into our communities, we have, like everybody else, so many protocols in place to keep the residents safe, to keep the staff safe. So, unfortunately, I think at the beginning of the pandemic, and I'm sure we can all speak to the same, is that we were all caught off guard, and it was very, quick, and wasn't expecting it. I think in the last year and a half, we've all gotten more control. We understand the virus better. We know the protocols in place that we need to have that will keep everybody safe. In terms of the assisted living communities, I mean, all of our residents here are vaccinated. As we all are hearing on the news, I'm sure all staff will be mandated to be vaccinated in assisted livings by October 8th. So that is another thing that is helping families feel more safe for their loved ones to live with us. They are now able to visit their loved ones, again, with a lot of protocols in place to safely bring them into the communities. And if we did have someone like everybody else that tested positive, we would isolate them appropriately as well. We do have the capacity here to test as well. We test our staff and our residents frequently. We also have vaccination clinics also to keep everybody safe and offer that to staff and residents. And in our communities, we are not allowed anymore at this point to take anyone in that is COVID positive. So that is a big difference than it was a year and a half ago, which again also takes away a lot of the fears.
Dr. Colletta, a question that we received from a few of our guests in the audience is going to the question of whether the healthcare provider, when I go into an emergency room, have they or have they not been vaccinated? And the questions we had, they range, so I'll sort of pool them all together, is, am I allowed to ask if the person taking care of me has been vaccinated? What is the proper way to do that? And if I'm not comfortable, since it's an emergency room, how do I handle that?
Well, that's a great question, but since the governor's mandate now with Northwell, every healthcare provider here is vaccinated. And I think you hear it from all the hospitals, that's the mandate. And we're going through now that some of the people who were refusing, but now are will no longer be employed here. So you can come to the hospital and know that all the providers, all the PCAs, the aides, the nurses, your registrars, everyone has to be vaccinated.
And Dr. Khan, playing off of that question, another question that a number of our viewers have asked is for visitations. And they're saying, what are the rules that are in place, or do you think should be in place for visitors coming? And then how do I know that somebody else's visitor is going to be following the correct protocols to keep me and my family members safe?
Well, like I said earlier, our primary focus is the safety of our patients as well as their family and loved ones. And so the protocols that we have in place right now for visitation is we have a certain designated time frame where people are allowed to visit their loved ones. But in addition to that time frame, they need to show proof of either their vaccination or that they have tested negative within the past 72 hours of them visiting. And so if, for example, if I have a loved one as a patient and I'm visiting and someone else sees that I'm a visitor, they can be ensured that I'm either vaccinated or I've tested negative within the past 72 hours. Eric, I actually wanted to take time just to follow up on the previous question regarding safety. And, we've all spoken about COVID, and the fear for COVID and the concern for COVID and the safety is definitely there and present. But besides COVID, we want to take this opportunity to reach out to everybody in the community to let them know that what kind of protocols or what kind of tools or screenings we're using to ensure that their loved ones, our older population, are being taken care of in the hospital, in the emergency room, as well as in the local community facilities as well. And so, Dr. Colletta, myself, as well as our team over at Glen Cove Hospital have really taken this age-friendly movement very seriously, as well as taken on our part to make sure that our patients and their family are, being taken care of in a safe way. And so we've taken the recommendations that are evidence-based through the Institute of Healthcare Improvement, through the Healthcare Association of New York State, and we followed the recommendations of following the 4 M's, which is making sure that there is safety around the medications that we are using. There's safety around their mobility to ensure that they are functionally stable, to make sure that we are making sure that their mentation, their mind is not being deteriorated while they're in the hospital. And finally, the last M, which is what matters most to them and to their family, and that we abide by their wishes and not go against it. And so we have certain protocols, we have certain algorithms and screening tools tools that we use to make sure that everyone in the hospital that is admitted, that is in the emergency room as well, is being taken care of when around those scorings. And we could talk even further about those later on during this period.
Excellent, thank you. Erika, going to that point, and the issues that Dr. Khan and Dr. Colletta raised, and how do you deal with the safety, the concerns of the patients there, but also with the families and the visitation and making sure that they feel safe, they feel comfortable, but everybody sort of has a different perspective when they walk in. What makes me feel comfortable for myself or my parents might be very different from the people down the hall from me.
So, when we have a new patient that comes in, we have our director of admissions and our director of concierge that will reach out to them and go through the protocols and go through everything. And like, as Madeline said, and as previously mentioned, we have different protocols if a patient is unvaccinated or not fully vaccinated when they come in, or if they're fully vaccinated when they come in. And so we find that information out right before they even walk into the door. And then we have specific areas. So if they're unvaccinated, we do have them on quarantine for 2 weeks to monitor for any signs and symptoms of COVID or any type of illnesses that they may have acquired that just haven't come through yet. We do then test them at the end of the 2 weeks to confirm everything. And then if they do have visitors, we do allow visitors as far as if someone isn't fully vaccinated yet as a new admission. Obviously, we do not want them to have any depression. Moving from a hospital situation and moving into a rehab, it can be a very difficult transition for some patients, especially if they have dementia or any type of altered mental status. So we do allow visitors as well. We screen all of the visitors. We do ask them if they're vaccinated or unvaccinated. And then if they are going into a room where we have a patient that is not fully vaccinated and they're still within their 2 weeks of a new admission quarantine, we ask the visitors as well to don and doff the PPE appropriately, which is right outside the room. So we want to make sure the visitors understand that we are not only protecting the patients themselves, the other residents, so everyone can clearly see outside that room that there's a patient that, we need to have some appropriate PPE that's put on and taken off when they're going in and out of the room. So I always speak with the families as well. If a family has any kind of question or concern about, the safety protocols, we do as well take the temperature of all of the visitors, all of the vendors, anybody that is coming into the facility, we take the temperature, and every single person has to have a screen when they come in. And same as with, as Dr. Colletta said, healthcare workers now in the nursing home facilities as well have to be vaccinated. So we are, obviously as of the 27th, pretty well every single one of our staff members have had at least one dose of the vaccination. And going forward, when we have any new employees, they'll have to be fully vaccinated before they can start working with us. So I have a lot of communication with the families and with the residents. And then the residents, as they are going to PT or as they are going to get to a bakery item, we ask the residents if they're capable to please wear a mask to also help to, not spread anything, as flu season now approaches us as well.
Exactly. Madeline, now Erika had just mentioned patients with dementia, and that is another large issue that our guests and audience have questioned. Are there separate or special protocols, considerations that the healthcare facility is taking and that family and caregivers should be taking for particularly our elder community, the people who have dementia?
Sure, absolutely. So for patients that have dementia, they do follow the same protocols as patients that do not have dementia. So it's basically the same throughout the facility. It's the wearing of the mask, it's the hand hygiene, which is very important, and the social distancing. And of course, when you have patients with dementia, it of course has challenges to that because they may not remember to keep their mask on or not be wearing it appropriately. They might not be remembering to social distance. So that's why our staff is educated, and we have continuous education regarding the infection control protocols. So where a patient might need a gentle reminder to fix their mask or maybe to stay a little bit further distance from the patient next to them, these are things that we're constantly monitoring throughout the day and reminding patients and families as well. The families that come to visit, we educate them upon their screening process. We give them literature. We verbally tell them, even if they come every day, we tell them the same thing over and over about social distancing, hand hygiene, and all that good stuff that keeps everybody safe. And of course, they understand the habits of their loved ones, and they also try to help to make sure that those patients with dementia, that we keep them as safe as possible. But the protocols are basically the protocols, and every patient has their own challenges at times, and that's why we're here to try to mitigate that as best as we can. So I think the most important thing for the visitors is really the education piece, because the visitors have to adhere to our infection control protocols as well, just the same way staff does, residents do. We have the same expectations for visitors. So when all the visitors see that all the other visitors are kind of falling in line with the same protocols, it really makes everyone feel much more comfortable throughout the visitation. Hey, they're sanitizing their hands, they're keeping their social distance. If they're not, the staff goes over, reminds them, maybe re-educates them. So we have all this process in place where everyone is involved. It's not just one particular staff member. Everyone is overseeing to make sure that everyone's doing the right thing. And it's really all in the safety, the safety of the patients and the staff and the visitors. It's for everybody's benefit.
Melissa, at the campus, how are the protocols being put into place, and what sort of education goes into the visitors, but also obviously the residents there for the social activities in particular? I think now more, whether it is, if there is a social gathering, whether it's for a film or to play cards or bingo, is there, questions still must be arising and how that can be handled?
Definitely. So in both of our communities, we did start up social activities again, which has been absolutely wonderful for all the residents, both in assisted living and our memory care community. The isolation, not only COVID, but the isolation to residents and the elderly, whether they be in our communities when this was happening or at home, was a whole other issue for the elderly. It really, they declined a lot because of it. So the social activities are back, and we have a lot of protocols in place for residents while they're doing these social activities. So obviously social distancing is a big thing. We actually moved a lot of furniture around. We've taken away some furniture because as much as we can tell people to social distance, like Madeline was saying, whether they have dementia or they're alert and oriented, you always have to remind. So there is constant redirection, constant supervision, constant help from the staff. So social distancing is one thing. During those activities, we are social distancing the residents, while we also have come into the, like with bingo, let's say, they all have their own bingo cards. They all have their own bingo coins or whatever you call them. They have their own art brushes, their own arts and crafts supplies. So anything that we're doing that we're touching, the residents are touching, we made them each their own baggie. So they are only touching their stuff. They're not going and touching everybody else's. So we've really come up with some creative ways to get them back into doing social activities, but safely. In terms of, even going out on trips again, that has started as well. Having entertainment or other types of pet therapy services with people coming in, religious services, they have to be vaccinated. They obviously have to wear their masks. They obviously have to social distance, but those things have all started up again, which has really truly made it better for residents living in our communities. In terms of the protocols of masks in assisted living versus memory care, just to go back to that, in assisted living, the residents are always reminded to wear their masks as well, kind of like Madeline was saying, just constant reminders. There's constant education. There's a lot of in-services for staff on safety protocols, visitation. Everything is changing from the Department of Health day to day. I mean, one thing you tell someone one day to the next can change. So we're always educating the staff as well as families, visitors, and residents. In our memory building in Harbor House, the residents that can tolerate wearing a mask do, but most of them it is very difficult for. It is agitating. There's a lot of anxiety with it. So the Department of Health is aware in most memory communities in assisted living, the residents do not wear them as consistently as you would in assisted living. So that is a little bit different, but it does help the residents with cognitive impairments not to get such agitation over it. And the vaccinations have helped with that.
Melissa mentioned there the points of social distancing and then also the term isolation. And I think that, we've all seen, even again, pre-COVID, the challenge, particularly for seniors who may not be able to get out as much, who may not have as many visitors, or who may be in a facility where they don't get as many visitors or don't want to go out and do something social, the challenge. But has that, and I'd like to each ask of you, and I'll go out to Dr. Khan first, the importance of socialization and the challenges of isolation versus distancing that you've seen over the last year and a half, and how do you recommend people really relate to that, and how do they address it for their overall health?
That's actually a really huge concern. Not only during the pandemic, but pre-COVID, it's a huge concern for our aging population because social interaction is a huge part in their well-being, not only cognitively speaking, but also their overall health. And so it's a challenge when it comes to reach out to our aging population in the community to have proper resources for them to basically interact, to socialize, and so forth. One of the hugest help that we've had is the Senior Center in Glen Cove, and that they have been actively involved in the care for our senior community. And we are working with them on a regular basis to ensure that we are able to reach out to everybody in the community that in our aging population. Now, the issue during the pandemic was because of the fact that there were limitations how many people can actually go to the senior center, two limitations as far as if they had to go more of an online interaction as opposed to coming to the facility and so forth. But now that we are so far into the pandemic, so far with the knowledge that we have and with the vaccination protocols in place, that we are actually, not we, but the senior center are allowing certain visitations, certain X amount of people that can come to the facility. I want to also take time to just, to go back to the conversation regarding dementia at this moment. And I wanted to take this opportunity to reach out to our community and our caregivers for our patients that have dementia, and just to provide a little bit of education between dementia and delirium. Dementia is a chronic progressive disease with the impairment of memory, but delirium is something that occurs very acute, and you'll see a change in your loved one's behavior, their mentality, and so forth right away. And so when you notice something like that, that is something that you want to have medical care intervene. It helps us out, and I think Dr. Colletta can vouch for this, it definitely helps us out in the hospital when we are able to know what the baseline medication for the patient is. Because unfortunately, it's when someone that has dementia, their short-term, even their long-term memories are impaired. And so the level of or the degree of dementia that they have, we would like to know from their loved ones that how they are at a baseline, because if they come in confused, we would need to know if this is something that is acutely occurring or if this is something that's their baseline. And so in the hospital itself, we do have screening tools that we, on a regular basis, twice a day actually, we do screen our patients to make sure that they're healthy from a mental standpoint, and that we can catch delirium or acute confusion early on. Because the earlier you catch it, the earlier we can fix it. It's something that is reversible, but the longer it's not being caught or the longer we're not able to care for it, then that unfortunately starts becoming long persistent delirium and can become their new baseline. So we want to provide not only education to the caregivers, but also ask for help that you guys also be able to be in keen with the mental, their baseline and their mentation at home prior to coming to the hospital. So it can help us out a lot.
Yes, Dr. Colletta, could you speak a little bit to that, particularly obviously from coming to an emergency department where it might be a rush situation? I'm bringing in a family member who I don't know necessarily, do they have delirium, is it dementia? And what sort of steps should we take as caregivers, family members, to help the staff there best serve the patient?
Right, that's a great question. So what we've done at Glen Cove Hospital is that we've just compiled our application to get from the American College of Emergency Physicians to be a level 1 geriatric center. We are at level 3 now, but a level 1, there's only one in New York now at Mount Sinai. And basically what it does is exactly what Dr. Khan is saying. So when the elderly patient comes in, the geriatric patient comes in, we use screening tools immediately from triage to try and identify the people who have delirium. We try to identify people with an ISR, people have difficulties with ADLs. We have changed our rooms. We've actually done construction to alter our rooms that are more geriatric friendly. They're non-skid floors. We have improved lighting and clocks. We have hired a full-time social worker 7 days a week, that her primary job is also to go and address the geriatric patient needs, whether that's even seeing them in the department and talking to them. And then actually we do follow-up calls within 3 days to make sure that we make appointments for them. We understand the geriatric population, sometimes it's very difficult for them to manipulate through the medical system. So when people do come in and they are confused, it makes it extremely difficult for us if we don't know if it's acute or chronic. But by using the screening tools and, we have staff education, all of our nurses and physicians have to actually go and get educated, and we have to continuously do it to maintain our accreditation. And the bottom line is that, it helps recognize the needs of the geriatric patient, and also identifying, saying, this is not something that's chronic with my mom or my dad. This is something new, and it's going to point us in a direction so we can quickly take care of it instead it becomes a chronic problem. So, you'll see ERs across the nation starting to strive for this. I think we're really on the forefront at Northwell, because every Northwell hospital is a level 3, which is unheard of too. But getting a level 1, now our application's in and they're reviewing it, they're going to do an on-site inspection, but it would be really nice to make sure that this gets to all the hospitals, so that when you do come with your loved one, or especially in a pandemic when you can't come as a family member, like we had no visitors, we have some tools to also aid us and protocols for every single patient, that we can identify people that we can help immediately.
I think such a large part of the care for our senior citizens is the involvement of the family, of the loved ones, the care, and how much education and knowledge we have, and also the questions that we don't know that we need to ask. So even one group of questions that we had, again, come in from our audience, and I'll direct this to Melissa, is the question of assisted living versus at-home care. Where do I start to make the best and the safest decision for a loved one?
So I think always best way to make your decisions is to obviously investigate and get knowledgeable about both. So there's so many pros to home care. There's so many pros to assisted living and memory care. You have to be able to investigate all areas, figure out what's best for your loved one, figure out, where they'll be taken care of the best. I think the biggest difference between home care versus living in a community is that with home care, listen, everybody wants to stay in their home, and we understand that. Most of the residents that are moving in here have been in their home for 60, 70 years. It's hard. Change is hard. And when you're older, it gets even harder. So most people start looking into home care first, but I think what they find is that it's hard. It's hard to get aides in the house. It's hard to have someone in someone's home. The senior citizen does not always love having a stranger in their home. They don't always love sharing it with someone else. They tend to often feel like they're being babysat, which is what you hear often. So it becomes a little tough. And if the resident or the loved one that you're looking for doesn't want someone in their home and they decide to say bye-bye, they have the right to do that because that is their home. So sometimes, but it is also a great opportunity for a lot of people to stay in their home, and you can reach out to certain agencies. You could always reach out to me as well. I'm a resource in the industry. I can refer to assisted living or can refer to senior advocates. I can help with home cares as well. And then the other thought process is to move someone. Is it the right situation? And a lot of people come to the decision that it is the right situation when they still see their loved one at home, isolated. They worry when the winter's getting bad. Is that caregiver going to show up? How am I going to get to my loved one? Am I going to have to find other staff? So living in an assisted living or memory community, or even a long-term nursing home community, it helps families have further peace of mind because it's 24 hours a day, 7 days a week care, whether there's hurricanes, whether there's snowstorms, whether there's blizzards, the staff does not leave. And the biggest part of living in a community, whether it be assisted living or even a nursing home, is the socialization piece. It's not eating alone. It's not just waiting for your loved one or your mailman to visit. It's being around other people. It's being around peers. It's stimulating that mind. And that's truly what really helps the senior population.
Now, a lot of our guests out there have sent in questions about their loved ones, but there's also been an outpouring of concern for the healthcare workers themselves and people in the industry. And we've had a few folks ask, and I will address this first to Madeline, for the healthcare workers, the idea of morale and the people who are working there in the facility, keeping their energy up, and the battle against the COVID fatigue and all this. How have you been working with that, and what sort of initiatives have put into place to take care of their health so they can take care of the health of our loved ones?
Absolutely. And that's definitely a challenge, probably across the state. I could probably speak for everybody. There is a certain level of fatigue. So from the administrative end, we try to do various things for staff morale. We have luncheons. We try to integrate staff into the residents' actual programs. We just did a Hawaiian luau last week. All different things that our therapeutic recreation department thinks of that will be a real morale booster to keep everybody's spirits up and to just keep that continuity between us and the patients, because when we do fun things, the patients, they're integrated into it, and it kind of all goes together. It's fun for the patients. We do things like fashion shows. Everybody gets to dress up and out of your scrubs, and we put these shows on for patients, and they really enjoy it. And it all kind of goes back to kind of getting out of that isolation for the residents, and also isolation for the staff, and doing this day in, day out. And it kind of breaks away from the monotony, and it's good for everybody. But it definitely is a challenge. It's every day we work on it. It's just a matter of going up to staff and saying, hey, I know you're doing a double today, and thanks a lot. We really appreciate it. And the residents are counting on you. They appreciate it. So having that connection with the staff on a one-to-one basis is a great thing too. Especially when you're working in a facility for a long time, you really get to have that connection with particular staff and get to know them and about their lives and their families. And it really just becomes like a second home, actually working in the nursing home. And we all kind of just do it together. But I would have to give credit to our therapeutic recreation department, which does an outstanding job for the residents and also for the staff. Everybody needs a pat on the back once in a while. And this pandemic is definitely initiating a lot of pats on the backs, because we have some stellar staff that really go above and beyond. And these patients become like family to them. So it's really like we had said earlier, getting away from that isolation, going into the day room, having a program, whether it's for staff, whether it's for the residents, and everyone just kind of getting involved. It really goes a long way.
Erika, what's your take on the question of morale and giving all those much needed pats on the back? What have you seen and implemented?
So yeah, same thing as Madeline. I mean, our recreation department has done wonderful things all throughout the summer and the month of September. We've been doing different themes on the Fridays. So tomorrow we're actually having country hoedown theme where the staff can dress up, you know, in their best country theme. Last Friday was Disney Day. We have different events then that will happen during that daytime event that staff can get involved. Easter time, you know, we had an Easter egg hunt specifically for the staff, where they would get a prize, you know, where they'd have to go around, and we had it for each shift. So we did it for the overnight shift, we did it for the day shift, we did it for the evening shift. You know, the recreation department has making everyone feel special on their birthday. So they have a cart, and for the and I'm speaking about not only just the residents but for staff. They'll go and they'll sing, they'll bring a big cart with balloons and a cupcake, and they'll sing to them a happy birthday. So we are really trying to do a lot of different things to say thank you to the staff. We just had a Summer Olympics where we had departments that, competing against one another in different areas, you know, so that was fun. Morale for, you know, each department against each department, and, you know, relay races and hula hoop challenges, you know, just trying to get the staff to have some fun. The thing that I would implore upon, you know, the facility visitors, the families, the community is, you know, when you do come to visit, you know, be kind to our staff. You know, they have worked very hard. They have worked very long hours. They've done, you know, a lot of extra training, and they've done a lot of extra things to try and make your loved one safe. So, you know, if you come upon a staff member that maybe doesn't have the answer at that particular moment, you know, be kind to them, and you know, understand that they've gone through a lot, and you know, we all are trying to work with different difficulties in our own personal life because of COVID. So, you know, just really have that heart for them. Know that they are dealing with some sicker patients. So we are trying to get and take care of everybody, but really be respectful and be kind to them as well.
Excellent. So now, as we come down the home stretch of our program here, we have had questions starting to come in as well. So I will go around and I will direct, we can't answer them all, unfortunately, out there in the audience, but we did get them, and we will ask them first. I will go to Dr. Colletta. And one of the questions we have here is, telehealth has helped a number of patients during COVID, but is it as good as getting care in person? And what level should a person be at coming to the emergency room versus trying to get a telehealth appointment?
I think, you know, telehealth has really helped during the pandemic, right? So it probably sped up telehealth medicine by 10 years or 5 years, they're saying in the literature, because it was coming. But since the pandemic limited people to get access to a physician, this sped up, and you're seeing multiple companies doing it and reaching out. And I think it serves the purpose for people, you know, if you can talk to a professional and they're quickly assessing what your complaints are, they can give you the direction, say, no, you need to go to a hospital right away, or no, you can be seen in an office the next day, or, you know, or even manage the case remotely. I mean, there's nothing like being a physician for 30 some odd years, you know, there's nothing like being face-to-face, interface with somebody, and you get a feel for the patient. You got to put your hands on the patient, and that's all part of medicine. I mean, you know, medicine tests only support what you feel on your physical exam, right? And if you take away the physical exam portion of it, and just the feeling of when you're interacting with the person, you're not getting 100%. I think it has its place. I do think it has its place. I think in these times when, you know, ERs were 110% jammed and with all critical patients, and someone can touch base with a physician and saying, do I need to go or don't I need to go? I think it does have a place there, but there's nothing like seeing your physician in person.
Excellent. Erika, I have a question here. I am vaccinated and my 80-year-old mother is vaccinated. When I go to visit her at rehab, do I really need to wear a mask and social distance when we see each other?
The ultimate question. So if a patient is fully vaccinated, and if their visitor is fully vaccinated and they are in a room by themselves, So if they are in an area that there are no other patients and no other staff members, they do not need to wear their mask and they do not have to socially distance. So if a patient is in a private room by themselves, or if a patient is in a double room but empty, meaning that they're the only one in that room, then when both the patient and the visitor are fully vaccinated post the 2 weeks second dose or the dose of J&J, then they do not need to wear a mask if it's just the two of them in that room, and they can have physical contact.
Excellent, thank you. Madeline, this question is, my aunt is living in a facility and she doesn't want to do any of the group activities out of fear of getting sick. What should I tell her to make her feel better and get her out there?
Well, I think the the real answer is, and the doctor spoke about this earlier, isolating yourself can make you feel sick, can make you feel depressed, can make you feel very down, can make you feel lethargic. So I don't think isolating is really the answer. I think the patient just needs some education from someone that they trust. So perhaps the infectious disease nurse that works in the facility, or someone that the patient has a good rapport with, can have a conversation about the protocols in the facility and let them know that patients that do have COVID are isolated and are on a separate unit, that they're not going to be in the day room doing programs. Even patients that perhaps we think are symptomatic for COVID are not going to be sitting next to you when you're doing bingo. Those patients are screened and they're screened daily. So I think sometimes fear can take over, and I do understand that. But we don't want that. We want our patients to come out. We want them to be physically healthy. We want them to be psychologically healthy. So I think the best thing is education, okay, from a trusted source is the way to go.
Excellent. Melissa, the question here is, my father does not want to leave home and I need in-home help. How can we be sure the person coming here will keep us safe?
So when you're looking for in-home help, I would talk to the agency that you're going through. Are there, I think, and I'm not 100% sure, so don't quote me, and maybe someone else knows, I think home health also was mandated for the staff to be vaccinated. Is that correct, Erika? You're nodding? Okay. So at that point, then prior to that, I would say that you would want to talk to the agency about the caregiver coming in being vaccinated. But since they're all have to be vaccinated, you would have that comfortability that they are vaccinated, they are coming into the home. I would do temp checks at home like we do in the communities and facilities. I would, screen them the way that you're being screened when you go visit someone in a facility. Think about someone coming into your home and making sure that they're keeping your loved one safe. The reality is, no matter where, whether it be at home or in a facility or in a hospital, people still leave and people still live their lives, right? So no one is living not many people are living in a bubble. So you just have to make sure that they're washing their hands appropriately. Maybe your dad will take their temperature, or someone else, or have them do it themselves before they come in, take their shoes off, suggest really keeping up with the protocols we've all learned about to keep someone safe. I wouldn't suggest having your dad wear a mask, but certainly that aide in the home, I would think, should be wearing a mask. And I would talk to the agency about your concerns. Mostly, they would be able to guide you appropriately.
Excellent, thank you. And Dr. Khan, the question here is, 1 year ago, as we were heading into into fall and winter from the spring and summer when we could be outside, what are some of the biggest recommendations you have to keep people safe if they're going to be seeing more and more people inside their homes and inside other facilities?
I think the biggest thing that we want to ensure in people regarding the pandemic and COVID and safety is, whether you're vaccinated or not vaccinated, one, we would highly promote getting vaccinated. But even those who are vaccinated, you should keep a mask on when you go outside, whether you're going to the local grocery store or even if you're going to visit someone. you should keep a mask on to ensure safety. I think the CDC, I may be incorrect, but I believe the CDC had recommended that if you are amongst those that are vaccinated, then there is you don't necessarily need to have a mask on. I may be incorrect on this, but I do believe that they had recommended that. But when you go out in public, you aren't aware of who's vaccinated or not vaccinated. So until everyone in the world pretty much is not vaccinated, I think the recommendation to keep ourselves and everyone else safe is to have a mask mandate.
Excellent. And we have a few more moments here, so I'm going to go around the horn or whatever shape you have there on your Zoom screen at home and give everybody a chance to give a final comment, final thoughts to our audience out there about keeping our loved ones safe. And I'll start with you, Melissa.
I think the biggest thing for everybody to remember is that you have to entrust the healthcare professionals that do this for a living, the hospitals, the rehabs, the nursing facilities, the assisted livings. We are all doing what we're doing because we love it. We want to do it. This is our passion. This is what we went for, doctors, nurses, whatever the situation may be. So we've gone through a really tough time in all of the healthcare industry, but I think what people really need to remember is that it's safe. It's much different than it was a year and a half ago. And anybody that is taking care of your loved one in any facility, any hospital, long-term care facility, or assisted living is doing everything right by those people that are living there or staying there for short term or coming into the hospital for short term to keep everybody safe. And I think that's truly what everybody has to remember. And make sure that you're taking care of yourselves and taking care of your loved ones so that, there's not other issues that come about.
Excellent, thank you. Erika.
I mean, Melissa pretty much summed it up. I mean, I would say, I'm sure, just as Melissa said, we are doing our very best. We, have a really good handle on what we need to do as far as the protocols, as far as, reaching out to the Department of Health. We have a great relationship with Glen Cove Hospital. So, having that communication with your local hospital, having that communication with your local physicians is a great thing for us at our facility. I would say, don't hold off on getting care that you really truly need, as Dr. Khan and Dr. Colletta had said, is if you do need that care, talk to that telemedicine doctor to see if it's something that is urgent or something that's a follow-up. But I would definitely make sure that you are following up with your physicians on a regular basis to make sure that you aren't putting anything off and down the line having something that's going to happen worse. So thank you.
Thank you. Madeline.
All right, so I think the biggest thing, and I think I touched upon this earlier, is really just the education piece. Good old common sense for the families and their loved ones. If they have questions and concerns about admission to a skilled nursing facility, they can call our admissions people, talk about this all day with families. They know the protocols. They can answer all your questions. They can allay your fears. And once you come into the facility, most people are really quite impressed to see how rigorous our protocols are put into place and how it's just really second nature for us at this point. It's not even something we think about. It's just automatic. It's just the way we live now. So don't have fear guide you to a decision that might not be in the best interest of your loved one. Inquire, educate yourself, get yourself to a comfort level, and then have your loved one come to a skilled nursing facility, possibly post-hospital visit, and get the additional care that they need before they go home or to an assisted living facility. And that's what we do every day. So those would be my closing remarks.
Thank you.
You're
Dr.
welcome.
Colletta.
Yeah, I just think that, for the public, keeping everyone safe is realize that in the medical community is to follow the science and follow the data. And we are on top of it all the time. And the best thing is to get vaccinated and using the common sense, mask and social distancing until we can get past this period. And also so that the public knows to keep your loved ones safe is that ERs are safe. they're safe to come to. I mean, you know, and I would speak for the whole Northwell emergency service line. You know, the protocols that we've actually gotten down so good, and it's just formatted in everyone. You're safe to come. So if you have a problem, come and you'll be safe.
Thank you. And Dr. Khan.
I wanted to, you know, we wanted to take this opportunity with this webinar to reach out to everyone in the community to have them voice their concerns and anything that they are worried about, not only from a COVID perspective, but also from just their overall care for their loved ones, whether it's in the hospital or in a skilled nursing facility or an assisted living facility. And, you know, like Dr. Colletta had said, from a geriatric standpoint, we are getting a level 1 accreditation. We are in the process of getting level 1 accreditation in the emergency room for our geriatric care. We at Glen Cove Hospital already been recognized at a committed to care excellence level for our geriatric care that we are providing to the hospital. And one of the things that goes hand in hand with that is our relationship with the community. And so this webinar is a way or a platform for us to let everyone know that we all the panelists here are involved in the overall care of your loved ones. And, you know, hopefully with the success of this, we want to keep on doing this and be able to reach out to you guys and see whatever your concerns are that we can, you know, take care of.
Thank you so much. Well, once again, I want to thank all of you, not just for joining us here today, but for all the work you've done pre-pandemic, during the pandemic, taking us through this next phase, for all the work that your colleagues have done, that your staff have done in helping keep our loved ones and our community safe. That work could not be more important. So thank you on behalf of everybody. Once again, I would like to thank our sponsors for today, Glen Cove Center for Nursing and Rehabilitation, Emerge Nursing and Rehabilitation at Glen Cove, Harbor House Caring for the Memory Impaired, Oyster Bay Manor Assisted Living, and Glen Cove Hospital Northwell Health. Thank you to all of our guests, everybody who joined us to watch this webinar today. To get all this incredible information, please visit liherald.com. We have many more webinars coming up where we bring in voices from the community, people who are here taking care of us, educating us, and making Long Island the best place to live. Once again, thank you all very much, and we'll see you again soon.